Hello viewers, thank you so much for joining me on this channel. One of the most important aspects of interacting with patients as a doctor is being able to obtain the proper history from the patient. If as a doctor we are not able to make the patient comfortable enough to share their story with us, then it becomes particularly difficult to diagnose the disease correctly. As medical students, we are taught at various levels during the course of our lives as students how to take history. With the advent of new regulations and with exams of OSCE pattern, history taking is not just important in terms of how to diagnose the patient, but it is also important in terms of how we communicate with patients. In MRCS ENT OSCE, history taking is one of the most commonly encountered communication skills stations. In this video, I will try to give you an example of a patient suffering from epistaxis, and maybe by watching this video you'll get an idea about how to take the perfect history. So let's get into it. It is very important to structure the conversation in a logical order. The conversation should start with introducing yourself and confirming the identity of the patient. You should speak to the patient in a manner that makes the patient comfortable to share their deepest concerns with you. You should definitely maintain a professional attitude. You should not avoid eye contact, and you should be able to express the right degree of empathy when required while communicating with the patient. Remember, you are not there to interrogate the patient. You are not there to interview the patient. You are there to obtain history, and non-verbal skills are definitely very important. The question that you ask the patient should be framed in a logical manner. You should start with open questions, ask the patient to explain what their complaints are, and then maybe ask closed questions to figure out exactly what is causing those complaints. Maybe you should talk about their chief complaint with history of present illness, then logically move to past complaints regarding other medical illnesses or other surgeries that the patient may have undergone. Maybe then you can talk about their personal history, family history, any drugs they might be taking, and their social history. In conclusion, you should also ask the patient what they are most concerned about, and then you should summarize the entire discussion, and within the stipulated time, you should thank the patient. Although I am describing this in terms of the MRCS ENT OSCE pattern, this flowchart can help you even in your day-to-day interactions with patients in your clinics. And this can also help MBBS students who are trying to figure out how to obtain proper history, especially with the new regulations in mind. Now look at this example. I will try to tell you how to obtain the perfect history with this example. A key thing to remember, especially in MRCS ENT OSCE, is you should not memorize questions. Suppose you have memorized all the questions you need to ask if you encounter this kind of a question. You might be surprised that if you have 20 questions, you might be required to ask only 10 out of them, because the questions depend upon the response you get from the patient. For example, if you ask the patient, "Do you smoke?" and then the patient says, "I don't smoke," then the next question should not be, "How much do you smoke?" Does this make sense? So pay attention to the response provided by the patient. At no time should you interrupt the patient while they are speaking, and then ask logical questions. Okay? Also, it's important to remember that in MRCS ENT OSCE, history taking can be its own individual station where you have 7 minutes available to you to obtain history, or it can be part of a composite station where you have to obtain history and then perform a clinical examination. In that case, you will not have all 7 minutes just to obtain history. So then you have to modify your approach accordingly. Now, assuming you have 7 minutes available to you to obtain history from a patient with this complaint, how would you approach it? This is how I would approach it. Please time me. Hello, I am Dr. Puspen Dasgupta. I am one of the ENT doctors working in this hospital. Could you please tell me your name and date of birth? Thank you so much for telling me that. How may I address you? Thank you, Tom. So, Tom, I understand you have some complaints of bleeding from your nose. Could you tell me more about it? Thank you for sharing that, Tom. I need to ask you a few more questions. Is that okay? When did this bleeding from your nose start? How often do these episodes occur? Does blood come out from one side of your nose? Does blood ever come out from your mouth? How much blood do you lose during each episode? Have you ever required hospital admission to stop the bleeding? Thank you for telling me all this. I need to ask you a few more questions to better understand why this is happening. Is that okay? Do you have any complaints of blocked sensation in your nose? Do you have any feeling of tingling sensation over your face? Have you ever noticed formation of crusts inside your nose? Have you ever noticed swelling over your neck? Did you ever experience any trauma to your head? Did you ever experience any trauma to your nose? Do you have a habit of picking your nose? Do you have to work with animals? Do you have any pets at home? Are you exposed to pollen? Did you ever have any surgery in the past? Are you on any blood thinning medication? Have you ever had to take oxygen through your nose? Have you ever had to take any other drug through your nose? Do you have any other medical conditions? Are you on any medications? Are you allergic to any medications? Thank you for sharing all this. I need to ask you a few personal questions. Is that okay? What do you do for work, Tom? Do you smoke, Tom? How often do you smoke, Tom? How much do you smoke, Tom? Do you drink alcohol, Tom? How much alcohol do you consume, Tom? Is there anything in particular you're really concerned about, Tom? Please feel free to share with me. Thank you so much for telling me all this, Tom. Just to summarize, you are having complaints of bleeding from your nose for the last 6 months. Bleeding is only occurring from the left side of your nose, never from your mouth. You've never required hospital admission because you only lose a few drops. You do experience blocked sensation in the left side of your face, in left side of your nose, I'm sorry. You don't have any history of surgery or trauma to your nose. You don't take any other medicines. You're not allergic to any medicines. Nobody in your family has similar complaints. Is that correct? Okay. Thank you so much for telling me all this. Now I need to perform examination to better understand why these are happening. I do have a fair idea regarding what might be a possible cause, but I need to confirm it by performing a clinical examination. Will you give me a consent to examine your nose? Thank you so much, Tom. So this, in my opinion, is how you should approach a history station. I hope you've got a fair idea, irrespective of whether you are going to appear in MRCS ENT OSCE or maybe you are preparing for MBBS exams with the new regulations in mind. Thank you so much for watching. I hope this video proved to be helpful. Take care, and I hope I'll get to see you in the next video very soon.